Talofa lava malo le soifua manuia. Whawhetai le mafuta mai i le whaungangana podcast. O au o Dr. Ioana Mulipola o le mental health nurse o longa lue o se whaia onga i le Universite i Aukilani i New Zealand. O le vaenga lona lua lenei, o le aoa'oina o le talanoaga ma Maiava Moana Solomona. Usi mai loa lau whaafonga. Toi fo ia lau fesili whaamon mo le Maiava i lau saunoanga i issues la ianga experiencing i Samoa about depression, le tele o tina matamaita e maua i le depression. Walana la o le na whainga luenga i Australia ma inei. Is it the same issue? Mo nei o tatou tangata pe ese?
No, I think it's same issues. It's same issues, and it's environmental as well as relational. The issues in Australia. They are like societal issues. They want to get ahead, or they live beyond their means, and then more relationship issues. Even though they resources in Australia, it's same issues. They want more. Samoa, it's like they 2 steps forward, 10 steps back. And then, but Samoa, expectation, the pressure. Samoa, may ainga. For them to succeed. O Australia mangusila I a whao lalo pisngisi, advices pisngis, o alu so sisinga wenga. It's more relational issues ma. Kele foi inge, o la inge foi more identity issues. About not knowing who you are as a Samoan or as a Pacific Islander. Samoa, you're not Samoan enough, or I see a lot of that here, and even isi nurses sama ko fengadwing e do fasa mo I popole apa awa kung isi I mako service. One time one of them said to me, "Vai, Moana, can you come and help the liulungali in there because they don't." I said, "Vai, you have all the mannerisms of a Tamaitai Samoa. Imagine those are your parents. Olala so kala yangala kwa visipe vaksipuki ma." I said, so I see that a lot here. It's like, well, sometimes I've seen the Pacifica, things. I always say to them, kani whanele ia koe o mai mangisi fasili o lokali. Nga wo makwa whewhia koe sa So that kind of attitude for ingale, it's like, there's a certain level of kindness you need when you work in mental health. And my mum, before she passed, olanga kala ngaya mako, my siblings says, especially mako ngalwenga, because we're all in social services. Yeah, that's it. That was the biggest thing that she used to say to us all the time. And I think it's true when you're working in this space, especially as a mental health worker. You have to be kind, and a genuine kindness, with all of your training and all of your life experience is going to help you have a more purposeful conversation. Assessment. Assessments, even with their doctors, because they're not going to go to a drug addiction service. GP. GP leo may referrals, referrals mental health spaces here, because if they get fat back, what our people are like. They and it's like that language has to change. So when I'm talking with my colleagues, I can see here the ones who have been in as long as me will over sanga. You can hear it when they talk the kindness, Maria Lofa, you know, fa'aloalo, you know, because kele or presentations, you know, if I go values, but what does it look like in practice? You know, what does that look like in practice? Because as a Samoan mental health specialist, I want my presentation to be different because just because of who I am. The conference, you know, they've asked me to speak at the conference now. And I think it's important for even our New Zealand born to understand the difference of how environment can affect your mental health. Not just where you live, but you know, wherever you are in your workplace, you know, it could be good or it can be not so good. But it's the way we communicate, you know, because all the communication that is you know, or they say, yes, you know, that kind of, because we had non-verbal, you know. I mean, I got colleagues when I say I need the 4 different tones a lot more, but I kinga, okay, Lord, blanga tone if I'm in trouble, okay, Lord, the tone that will fear. That's how we listened. Or else we learned from watching. You know, they say, you know, you know. And I always say to your clinicians here, not just but orientation are new nurses or new clinicians. Your first tools are your eyes. Because when I ask you and you're saying your stethoscope, my low blood pressure, I said, your first tools are your eyes. I said, because when your patients come and then they see you, that first point of call, that first engagement, anxiety just from your tone and the way you talk. Clients, sometimes the social workers, they'll say, oh, Mona, someone social worker, or someone. One was a toke allowance, but you know they can speak. I'll ask he's recovering from a stroke. Okay. So I just while somebody I said, may you know, and I said, why my? He goes, yeah. Oh, therefore, you know, sounds going. I'm looking at the wife, but you know, they Tina, yeah. You know, for me, you know, that kind of, you know, kalayungari. If I can it keep me fakalango, may nurses sa mo may makala ya community nurses nurses is also hangi go sing siomana mema. It is a mera ya ko ingala pa pe me kalinga. Ako so lucky. So mangwea you know ko ruala fa may la kulanga ga ruenga dos full ko sanga ati na nga penga may early child may you know, you know, and it's and it can't go for my don't fat makala may like go file city council will he must go sanga or fire. And then I was saying to the social workers that I was doing a workshop, I said, Okakukanga. And I go remember go assessment is full me okay. Our assessment sometimes it's an hour because you're talking for about half an hour. You're proceeding if you're proceeding. If I may, your mauli ole whakawhanaunga tanga o Samoa, you know, it's that's the thing. If you don't engage, I didn't no engagement kaka. Oh yeah, ngal kari but e ka konga va ai fa leo makama fa longo fa leo karinga. E loa for yeah. And you don't have to be a mental health specialist to be able to do that, but you need to understand cultural pathways or cultural communication.
Sa ole
You know,
le lau
because
sau noanga. Ole esele tā ua ole iloa ole tū maleanga nu. I tu nga i tu tonu ngā luenga ia tau te whisosoani ai ina yo
Yeah.
tatou tangata. Taua i ole mata upule wa e speaking na maiava. Ole ngangana, ole language, ole
Yeah.
positive language e ki
Yeah.
liva i le message,
Yeah.
A wai
Yeah.
fallinga mai e sa ole lei i tatou i te tonu o a inga. E le
Yeah.
ia se language le lei fo ina le
Yeah.
e uplift, e se anganga o se si.
And sometimes, sort of king Mario lo makolo makuan, and my mom bought her here.
Yeah,
Le lo makua leva ngai, auntie, leva ngai ole lo makua, and makolo makua is strict dear, it's like,
yeah,
and so she, auntie, and so when she came, and ngofai nga daughter, my cousin, kusanga fai kinga, she's like our sister. Sometimes, okay, my sister will ring and she goes, lo makua, whatever happened. And then I said, oh, fairly, mom came and picked her up. My mom, okay, like, like, oh, full of day on TV, because my mom was a baker, I asked him, and as soon as I walk in, because they look angry, and I said, Fifi, oh, they are fooey. And they said, yeah, Kalo Faya Yesu. I figured, okay, I'll talk about everything else. And I'll say, hello, Faisy, la, kenge malang ko odua. Auntie. And then, I've got to listen to her, and then, and get, and I always tell my mother off, I said, right, mom, see if I'm up for four, it's all right for you, get out my also, but, mother, say, say solution. And it's that conversation. I say now to, nurses, Maiava Moana Solomona She that I'm working with.
yeah,
Right. Ngai ko ke rofo fo koe ngā patients ngā mai, because if you go there and you just look at them with your eyes, and even nurses, you're looking at their neck or or their blood pressure. E mawhai anga fo without an assessment. E o mai parang fela ko triage. We is kako e foi fenga kako triage, but it's that conversation. Even when they say, yo leo ke manguia, you can tell by their tone, e me na de fear. Yeah, and so it's like, as if kala mo. And even if you go to Samoa, ya maka upua, le whamasingo le swafa mamatai. Because sometimes okay, ali mediations, oka, it's like, le whainga kaya, like our boss was saying, moana, so we swallow pule ka upulea, and I'm thinking, we. So I always have to explain. It's the hardest, not because of I obey, like they're coming for a war, but they're the same family. So I always, makar kakalo, ask one of them if and I always keep my tone low.
yeah,
And I always say to them, at the end of the day, in le maua ile kali, faya o kol kali ko fungo, wa a o koloi o famasinga, la pule mai la ko I ko famua ma ko le ka pokala ngom. Yeah, I mean it takes longer. But you have to set the tone. You have to set the culture, just like in counseling. Just like when you go, I mean, I had to go to a little village in Falealili called Piu. There's only about 80 people in that village. Yeah, and my heart was like, about that. But I was able to talk to the Whaiwhea Wasale, and he recognized some depression. So that's why I came out, because of we all used to play together. And I said to Mama, she goes, you know what? It was a conversation between me, the Whaiwhea, and two elders. Case. I knew that the man they were talking about, langa behaviors, it's a beginning of dementia. It's not, they were saying it's mental health, sometimes all of the. I said to the Whaiwhea afterwards, I'm going to try and find se for mai o la ua ai pe uma o dementia si ko inga. Me ngai for me e whai ama ngalo, think for me he's only 74. that's old for Palangi, but not for Samoans. But it's he wanted off. What if we quiet any fences, man? And so the whole village, there's about 80 of them. They also, I mean, but they said he was acting a BR, but people were getting upset, and I said to my colleague, I think it's mentioned going, and I told the Fifi out, and this is them. Me Samo. Because he thinks they're still active in the and I said to him, oh yeah. I said, kako wo pe vai pe lase kala for my, So it's just it's not to resist when they are bringing their ideas, but just to say, oh yeah. I it's the same here, when this son and daughter, they built a unit, mo stroke the ko inga. Me kala ko inga, di mas kau sanga kala mo for ma fale ma. But when ma fainga ngaru e langa wheelchair. And wakangi langa daughter for my ulenga, her and her husband built a unit, man. And I said to her, alango fa atama. Aba ko ki se nganga hoa e maka pe kako mai no fale. So I left that case with the social workers. And then about 3 months later, I said, hey, oina case is going, and now the daughter said, when they go visit them, he always, vai, faima viri, mai, awole o mai o le, kake o mai asi.
Hoi nei o lele malamalama lele ia ma peona e saunoa o le a hoi nei o le ave le information ina ia malamalama ai ia ma faile mea lai mana na o ai ia tangata ai le o le alato ita le pe fia poto ma vatuo ia mele mana o ai le tangata ma le tangata fainga luenga e tauna whaalongo.
E tauna whaalongo. I mean, o to tele ata tata i wo maua i le diabetes ma. Mai diabetes ma. E adu da, o le ulukari i lega makoias. They're older. Okay. Ai misa nei a ko, inga manako, pai ko, inga lau whakalan ko li wasa nurse i lang ko lua. E wo saan ko e pua. Whaasa. Pa mai ko inga, nei masisi pule na bla. Vale. Ele whaasa, but e came in e le ai male mai kuka wha de le ia awanga i nga o lau ke explain e kama whai e kāka la le blood pressure ko inga lai mako ai ka ko ala po i saule ko rua ia malanga training as a nurse. And I said to lau kala i le nurse toke lau lenga mau paksi mari e kir kapkanga kape wo pule me but it took me about 20 minutes to calm him down, but I'm listening, and he goes, I may ni makau sanga, and angi ma no ko ruole nurse say fa barefoot, So it's like, how do you work with that without forcing lo awakela ko malo degree ma, go forcing. Because it's that thing, olai lo alako. But it's like we just have to validate because when you say o it's a ma. I say fa longo la so pe la so fa longo. It's like it's like
communication Maiava ole male language fa o ngai ki liva ile le message mai ia le file mu o le mafau ma le loto. I think so se mea e o folinga luenga le tate whainga luenga i wala ala na mafatia le mafau o le language. E whaonga e tangata e communicate ai. Ia e au mai foto file mu pea choose le leile language ki liva ile le whaau ma le message.
It's and so it's being mindful, I think yellow advantage by lo Samoa, or if you know your language, because that's another way. Yeah, but even if you don't, malamalama o I ka koa culture. E mawhai anga
Yeah.
whainonga wenga, you know, it's a, and don't think, you know, ele mawhainga nga e alwe ke ngalue makaka Samoa, on kile do fa Samoa. I say, ke lo, they're gonna ask you first, but why you maku?
Mm.
You know, and then they'll, you know, for, wa walunge whaingi I fongo. E re fisi mai pa wa degree, pa wa me fisi mai pa, why don't we more fix so my mama? Yeah, that's what they want.
Mm.
It is that they make feel degrees, you know.
Fi sa'olele.
Yeah, and so and you know, baka sa nga kasamo. So I remember like Kikela San is only 3 was a masamo. And I like malanga salu, I like salu fellow malo. And my grandma said, "Okale poco so kama." Yeah, I'm may laid off I fit out. You know, that's how you I some low degree I laid off I fit out. Well, yeah, and that's our thinking. I malamalama culture. That's how we think.
Yeah. Mm.
So when you're working with our people, your conversations nga e malamalama lei I mea lai tali tonu ai, you mo ubela influence ai el mafau, and you'll get a better assessment of how to work with that person. Makangaka ia mai sosoangi
Mm.
I whaingaronga luenga.
O sala e ke lea le mo o mia o le au
Yeah,
whainga luenga e le ngata o Samoa e po Pasifika. Ia o
Pacific.
tātou atu no o Samoa to o te lea almana o mia o tātou. E le
Yeah.
ngata la o le malamalama le culture, I kako
Mm.
values. Ia ma le
Couple
malamalama fo
values.
i le ngangana. E mwhisi o
Yeah.
ta ai mana I o tātou tangata. O te fia fasili atu ala mai awa wha mole mole I le whaitaua o wha o tātou tangata Samoa. Pe e wa 5% o le whaitaua o wha o le tātou population o le tupulanga talavou.
Yeah.
O le youth.
Mm.
I lau experience la malo ngā lue ai I Samoa. O ani
Mm.
awala e wha talanoa ai le soifua o le mawhauwhau la mo le au mo le tupulanga
Tupulanga.
talavou wha mo le a Maiava.
O le pena o e tupulanga I Samoa. I think e to te leia ia NGOs lo wo nga lue mo le youth.
Oh, okay.
Because o nga wo kele le influence ai fafo up. You know, and some good, some not so good. You know, and you know the whole olako identity Samoa. Yeah, mamela nga oe travel, but you know it whenga ka for because of the depression for youth, and a lot of it I think it's around relationships for yeah
Yeah.
and drinking. When they talk about drinking for our youth, you can generalize for ingale at the age where they're drinking oleo e whakaikai, but when they're using it to numb pain,
Yeah.
I always say to them, youth, whether they're doing it socially or whether they're doing it because of kakonga yengi ngi laku programs hoingale. But how do you do that? So I ole university nga maula contract from an NGO nga o suekupe okay if I say proclame ole university in US.
Yeah.
So what I did, we asked around kids that are interested in counseling or interested in peer support. So there was about 18 of them. I started 10, but then there was more. Yeah, nga faila workshops for 8 weeks just to teach them basic listening skills and counseling skills, and it was a peer support program. And so every Thursday, I think in US, they have t-shirts that just black t-shirts, and in white it says "Talk to me."
Oh.
And they're actually there to support the counselors because youth are more likely to talk to another youth than to an adult. So to launch a peer support network, that group. And then they had some creative arts where they invited kids to do to come and present something to do with certain topics, depression, suicide. Honestly, it was so amazing. There was dancing, there was poetry. They came, there was singing. So it was a way to talk to them about these issues through the creative arts. So ke leo o mo NGOs, I lako polo kalame mo le youth. They either go into churches, or they do programs within their own services. And I think, how they get funding, it depends on the NGO. I would talk to some ministries about the need areas they need, because that's just for like the town area. I feel kuwama, And so, for probation, I think for them too, when they are doing their workshops, how are you doing work for the youth? I know with the Samoa Victim Support Group, lako youth programs, not necessarily in the churches, they're doing it in the villages. And so when you lako kangakaye, the villages that they are working with, those are like their first point of call. Need, like social needs for so I think there's a lot of work that they're trying to do with youth. Okay. Because all that generation there, they will talk more. You see that they want to talk about everything. But I mean, I've had cases where I was asked to it was a netball coach. I will behaviors it's changed and something's happened. So then they contacted me. So I don't always go and talk to the ones that I refer me. Okay, referring because they already know her. And I said, why? Does she trust you? And she's, yeah, okay. And so then I'll just say, well, these are the kind of things they have with the CDA, kalangoa. And then come back. And if I bring up with the youth peer support, there's a 0800 number. Oh. And also they have access to me if they feel like something, they've told you something that it's beyond, and you then they'll call me for peer support. And then I'll say, I think they need a counselor now. So it's trying to get those the SVC, we have a 0800 number. Oh, okay. And they have a shelter now for domestic violence issues. And so sometimes when I was there, and then we take it to the house, and then I'll go and spend some time with the So there is youth work being done. I think it's just funding issues. I'm trying to get, money to do the programs. Isamo, you just work with what you have. Yeah, it's resource. I mean, but it's the awareness programs, my campaigns. They've been a big help more to get the message out there, go break the stigma. But the stigma has to be broken first. But that are working in the spaces, like in the courts, with judges and lawyers, and they need to understand it too. I mean, sometimes even CEOs or MPs that I know of them, sometimes I when I look at them, I'm never shy to go and ask them if they're okay, because I have a clinical lens as well as a cultural one. And it's being unafraid to say, are you okay? And I always talk to the youth about that. Don't be afraid to ask somebody, and don't just listen to what they say. Look at how they look and how they, feel. Because I always know in Proclame, the courts, especially Proclame Kamadalo, the alcohol and drug. I always know that they're progressing when I see the way they dress. After about week 4, because it's 16 weeks. Week 4, they don't look like they're now taking pride in how they look. And I always say and sometimes we don't notice that when you're not working therapeutically, but I'll say to the staff, Mangeli progress, and they said, oh, how do you know? And I said, look at the way you're dressed. He's taking more pride in the way he looks. And sometimes when you ask them, may blokalame, they'll say, blokalame, and then that they just leave it at that. And as soon as I say, and then they're like, like this. And I always say to the officers, ask them direct questions, because of course they're going to say it's great, but ask them, and I love it when they say they learnt, things, i rako mawhawhau, o lewa uloa, ke me lau ke kai, o lewa uloa, mahuanga, o lewa sui. And they just talk about everything they've learnt, And I said, well, that's how you know, o lai whaalongo, o lai la wao ngā lea onga, and because, especially with the men, I'm saying to them, your sons and daughters are watching you. It's like, be the kind of man you want your son to be. It's like, and I can't go to translate, it sounds harder or it sounds deeper.
Yeah.
Than if you say it in English. And so you can really see them feel it. They're all engaged and they're all involved. Be fear that they're learning something.
Oi la lo whaua walau le ngaluenga le sa e whai e Samoa. Fōlinga me o se ngaluenga pitusili ni tāua.
I think all the probation services,
okay.
we lo uma whaia initial assessments. So from there, olako, depending the level of assessments, either if whaia lako le plokalame, or if it needs clinical, more acute, more severe, e ave o Salvation Army. So that was good because before, whapea, ele mawhainga whai se kope ale se clinician, but they actually just need people that can do initial assessments, culturally, cultural assessments, and then refer ile because Salvation Army are the only ones in Samoa. You qualify clinicians. I think there's about 5 of them there now. And they've got the drink driving one as well. And they all for trainings and clinical support more, because the NGOs. I mean, but there's a team and they've got systems. So I felt okay to leave Samoa because of the way, Salvation Army or but even while I was there, in the field, I should say to him, many container, many resources. But people want to help, but they just need to understand how things work in Samoa and what they can do to assist. But yeah.
Saolelei man mole fief soani. But man ai lau sau noanga ia I loa le tuainga fisosoani ma le wei e deliver ai le fisosoani mo nei o tatou tangata.
Yeah, saolelei. Yeah, you just got to keep those doors open.
Yeah. Saolelei. E talu ai lai fōlinga mai e sere tele o au matawhai oi ma unga luenga e whai. O le whawhela na wa ia le leile soifua manui o lau ma fau ma le tino I le tele o unga luenga o lo whianga I ma o e whamole Maiava.
O le vera ngā a whainge o workshops o le maka upua ngā kaua. Le whawhenga e mai oi because o le ngā luenga e whainka ngā luenga. Yeah, we have a lot of training. Because I think in the beginning, came in ngā whaia workshops not just probation, but NGOs. Okay, vai aku I ngā kaia that the ones affect I stories here whaalongoi, but even sometimes in court fake cases, if ka ngisi umaya, se me ngā kau I kaisi came because of my training. Like the judge is upset, the prosecution, and I'm thinking in my mind, and I remember the judge said to me, it can affect all I think because of my training, I'm a training for to disassociate, to be objective. I said, issues, they don't belong to me, And so when I would, when my friends would say, how do you self-care? I said, well, it's a very therapeutic environment. The sun shines all the time. If I can smell food and see coconuts, it's therapeutic. But outside of my work, I spend a lot of time with my family. I've got a big family, and isi ke miko mai malako issue. I'm not working, but I spend time mostly with my family, Samoa, and they're not my siblings, but second cousins, One of my cousins, former AG for it, she's got a law firm in Samoa. You know, sometimes we'll say, "Kako isa va, oi ki irunga na va kako," you know, but be really intentional about resting, you know, and not because very easy in Samoa to become a workaholic.
Yeah.
You know, you don't have a rest period. You make sure you look after yourself because Samoa is like that. It's work, 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 you know. And then it's like your stress goes to your family, you know, and all out kalangai, you know, my friends in the vai, out on the weekend, o ko e mawhawhausisinga, when I focus I shall call ua marofang, au maoi, e sama valima, you know, and it's making things simple. Sometimes when you say to them, "Oi, ave ko kai ko ua whakawhau," you know what they'll say? E ringi kupe ringi. Say to one man, vai. Nganga lua o amaro ko ua o ia pinga ki whakausua inga whakala, masofo sa apa ingu kala. Rua mai ra ingo whurunga le si wo ma uli mama, ma kisi kisi runga le si wo, e re whakusi se o I re tau masina ma. You know, it's like small things, you know. And so all me whainga whai, you know, ili weekend, because sometimes they'll say, "Oh, le ma ke over," and I'm very. I said, "Oi le o le ke alu kuai piu." It's very intentional. My self care is more, you know, and I had a small group of friends, you know, but you know, it's a small island. You realize how small it is when you're living there. Everybody knows everyone's business. Oh, Samoa foi. Sometimes, okay, like if people feel you stop, it's the middle of the day, right? And then they'll come and they'll work longer hours. And I'll say to them, don't work after 5, right? You can make up your time another time, you know, have a shorter lunch but don't, you know, don't stay late just because of things like that. So you have to be intentional because you can easily, I think I got caught up in that work because not having another therapist on island or another specialist, I have no one to vent to about my work. And so,
yeah.
well, this is a debrief. So, in New Zealand, if I'm debriefing, they always laugh when we have our Zoom. And they're like, "Oh, you're all right." But yes. But yeah, I was grateful to have my close cousins there, you know, that, you know, we're all and they learned not to talk about work with me. Sometimes they'll say, "Mona, do you think I drink too much?" But if you're asking that, then you probably do. You know, so it's you know, I loved that I had, you know, cousins and women that in the world of education, so we could talk about different things. Yeah, but yeah, it was you have to find ways to self care, or otherwise you get caught up in all of the
Is that the
drama.
same? Is that the same in New Zealand?
In
No
New
self
Zealand.
care.
Well, I think it's different here because over here, le opportunities it can work from home, and so it doesn't feel as stressful, even though it's a heavy workload. And so I think I'm trying to set up my own community reinforcement again.
No support system.
Support systems and I have colleagues samako trained kasi samako aonga kasi nga aonga foi maliming ska mental health gaming but I see a lot of there's a good Pacific workforce in New Zealand that sit at all different levels. You know, we've got a huge nursing workforce, you know, doctors and you know, we're trying to get more OTs, but we and there is growing number in the mental health space and addictions. So, and I'm really happy to see colleagues that I worked with 20 years ago. They're still here, still grinding, you know, still fighting
still in mental
good
health.
fight.
Still in mental health. Oh.
Yeah. And I said to them, you should be writing things. I mean, I want to write about my experience in Samoa. I might do it in a master's or something. Yeah, and I think it's important for those who want to work there. Well, expats that want to go back and nursing. The ones here, nurses, I said to them, do not expect that it'll be the same as nursing in New Zealand. I want to write about mental health in my experience in Samoa.
Yeah, okay, lo wa answer uma questions ile ka whakalangoanga. Ia pe, ye se mea te toi fia saunoa ai e wha uma ile ta
No.
talanoaga.
Ia whawhetai lava mole ava noa, Joanna, e ka ua lava, ia no ngā ruenga, and and mine. But I think it's good wo whaonga fo I podcast ia whaalongo uma mai le lau loa, and spread out the word for ngale ko mawhai break down the stigma ma sosoangi, to bring our data down, me go suicide, ma depression and now. But thank you for whetai.
Ia, malo fo I whawhitai Maiava mo lau taimi ua whaawanoa fo I e tate whaatalanoa ai. Ia ma share mai fo I low knowledge. Ile fo I nei I lau ngā luenga o lo whai, ia e awale le no fusila fia le malu le tatou atunu. Ia o le ele tatou therapist o lo ia o lo whai manga lue Samoa, ia mai nei, ia ma Australia fo. Ia o se awanoa matango fia fo I e sila fia o mai ele malu le tatou atunu. O lo to o tele lava le tatou tama alo ma whanau o le atunu o lo o ngā lulue e I tutonu o le nei auaunaga le mental health. Ia a mo lau sunga le ngata o yellow clinical hat as a therapist. Ia ma o lo o e fo o le director ma le principal advisor I tutonu o le te whatuora, Health New Zealand. Ia a e whaamalo whawhitai mo lo taimi mo le tātalanoaga. O nisi o mata upo sa talanoaina. O le ngaluenga le mental health, e mo o mia le alofa ma le whaapalepale. Aemaise o le ngangana file mu e mo moli ai le whiau. Ia whaamua le vaai le lei o lo soifua maloloina, e le ngata e le tino, le anganga ma le mawhauwhau. O le talanoa ma whaailoa le tāua o le soifua le mawhauwhau, e ave e se ai le ngangana whaaulaula. E tatau ona amata mai I ofisa ma matanga luenga mawalunga le malo, se ia pa ia a inga manu, iso o se vaenga. O le vafe aloaloai, fa aloalo ma le alofa, e tāua lea I le toofi le mu o le mawhauwhau o le tangata. Ia le ngata I le silafia, ai ia whao ngā masavali ai, e ala I upu mami o ngai whaia. O lo maua le fisosoani mai le Salvation Army Samoa pe amana o mia, mo tatou a inga o lo o alala I Samoa. O nei whamatalanga, e mo lo se la fia. Ai a whai o e mana o mia se fisosoani mai le mental health, po se isi o le ainga, wa ai lau GP, po se auaunaga le Pasifika e latalatane ia te oe. Whamoe wa ese au ngā o whamatalanga sa talanoaina, mo oe ma le ainga. Mo nisi whamatalanga, pe fia whaailoa so finangalo le tatou porkalame, fe so o tai mai I le e-maili, joanna@whaunganganapractice.com. Po le asia si ane I le Whaungangana Practice website. Whawhetai tele I lau whaafonga mai, manuia ngā luenga o whea ngai ai ma le mamalu o le tatou atunuu, so I fua ma ia manuia.